Hi, my name is Valerie Van Ostrand, and today I'll be presenting on hepatitis A virus, otherwise known as HAV. What is hepatitis? Well, hepatitis itself is an inflammation of the liver. Hepatitis A is a highly contagious liver infection caused by the hepatitis A virus, and it can range from a mild illness lasting just a few weeks to a severe illness that lasts several months. Some fun facts about HAV. It was first identified in 2016, and there have been more than 25,000 cases reported since then. In 2017, there was an estimated 6,700 hepatitis A cases in the United States. Outbreaks of hepatitis A are still continuing across the US today, and the virus was discovered or was first visualized by immune electron microscopy in suspensions of fecal samples collected from individual human volunteers. Imagine volunteering for that. Okay. Next, what is the genetic makeup of HAV? HAV is a positive strand RNA virus. It's a member of the Picornaviridae family. Sorry if I said that wrong. And the RNA genome that is inside HAV virus is packed with an icosahedral protein capsid composed of 60 copies of each of the three major structural proteins, V1, VP1, VP2, and VP3. This next slide is a visualization or illustration of the previous slide. If you are interested in looking at it, I'll leave it up for a few seconds. Okay, next slide. Pathogenesis of HAV. Infection with HAV usually occurs by the fecal oral route of transmission and is associated with extensive shedding of the virus in feces during the 3 to 6 week incubation period and extending into the early days of the illness. This is why we see high prevalence of infection in regions where low standards of sanitation promote transmission of HAV. HAV is highly stable at ambient temperatures and at low pH levels. This explains why the virus has the ability to survive in the environment and to be transmitted by contaminated foods and drinking water. Resistance to acid pH and detergents also account for its ability to transit through the stomach and exit the host via the biliary tract, which refers to the liver. How can HAV be transmitted? Well, hepatitis A usually spreads when a person unknowingly ingests the virus from objects, food, or drinks contaminated by small, undetected amounts of stool from an infected person. Hepatitis A can also spread from close personal contact with an infected person. This can be through sex or through caring for someone who's ill or etc. Food contamination is also mode of transmission. This can come from frozen or undercooked food. Contamination of food by hepatitis A can happen at any point of the food process. So this could be the growing, the harvesting, the processing, the handling, and even after cooking. So still got to watch out. Many people, especially children, have no symptoms. So a person can transmit the virus to others up to 2 weeks before symptoms appear. What are the symptoms? Well, here they are. I know you can read. So what are the symptoms? Well, I know you can read, so here they are. And jaundice usually doesn't appear in young children, but older children and adults with hepatitis A um, have jaundice or can have jaundice as a symptom. How long will these symptoms last? Symptoms usually last less than 2 months, although some people, which would be about 10 to 15%, with hepatitis A can have symptoms for as long as 6. Diagnosis and treatment. Diagnosis is fairly simple. You can go to a doctor and tell them your symptoms, and they'll take a blood sample and they can tell you from that whether or not you have HAV. Unvaccinated people who have been exposed recently within 2 weeks to the hepatitis A virus should get the hepatitis A vaccine or a shot of immune globulin to prevent severe illness. To treat the symptoms of hepatitis A, doctors usually recommend rest, adequate nutrition, and fluids, all the same things that the doctor would tell you if you had the common cold. Some people will need medical care in a hospital, but this is less common and it depends on the severity of the case. It can be a few months before people with hepatitis A begin to feel better. So, who is at risk for having HIV? Well, people with direct contact with someone who has HIV, travelers to countries where HIV is common, men who have sexual contact with men. Now, this one I was a little bit confused about why the CDC put it because it doesn't just have to be men with men, it can be men with women, or any combination of gender. You can still get HIV from having sexual contact with that person. So, um, okay. Continuing, people who use drugs, both injection and non-injection drugs, are at a higher risk for having HIV. Household members of caregivers of a recent adoptee from countries where HIV is common, and people with clotting factor disorders such as hemophilia, and people working with non-human primates. So that would be chimpanzees, gorillas, etc. Prevention. How do we prevent HIV? Well, you can get the hepatitis A vaccination, and you need 2 shots because after the first vaccine you receive, in order for it to work fully with full benefit, you need to get another shot 6 months after your first shot. Use common sense. Wash your hands as you should. This should already know how to do this from being in this class. After you change a diaper, wash your hands before you change a diaper too. Before you eat food, after you eat food, while preparing food, the common things, the common preventative measures of getting any infectious disease go for hepatitis A. Then there's something called PEP, which is post-exposure prophylaxis. What this means is, I mentioned it earlier, is within 2 weeks of exposure to the hepatitis A virus, you should get either a shot of immune globulin, or the hepatitis A vaccine. One last fun fact about hepatitis A is that the virus is able to survive outside the body for months. At high temperatures, such as 185 degrees Fahrenheit, if you boil the virus for 1 minute, it will die, at least 1 minute. But freezing temperatures do not kill the virus. And that concludes my presentation on hepatitis A. Thank you.